How to get pregnant without sex. This may be shocking for some of you because we all know that for a baby to be formed, sexual intercourse is the most common way and the most effective way to go about it. But there are alternative methods that are available for individuals and couples who are unable to or who choose not to engage in sexual intercourse. In this video, I will be discussing some of these methods and how effective they are. If you're new to my channel, I'm Dr. Amarachi Ijeoma. I'm a fertility doctor and my channel focuses on everything fertility and women's health. So if this is the kind of content you're interested in, keep watching. So technically, for a baby to be formed, the sperm has to meet the egg and fertilize it. The way most of us are familiar with is sexual intercourse, right? Because when trying to conceive, just at the end of sexual intercourse, a man ejaculates his semen into the vagina of a woman. This semen contains the sperm that will swim all the way into the woman's cervix and into her fallopian tubes, waiting for an egg to be released by the ovaries and into the fallopian tubes. It's in these fallopian tubes that the egg will be fertilized and an embryo will be formed. This embryo will then travel for a few days into the uterus and then implant there by attaching to the already prepared wall of the uterus. This is where it will then grow for 9 months. So at this point, some of us are wondering, how in the world can we achieve this without sex? The trick is, if we can bypass the sexual intercourse part and get the sperm to fertilize the egg, then we will get a baby. So there are a few methods that actually do this, and I'll be sharing them with you. The first method we'll discuss is intrauterine insemination, popularly called IUI. IUI involves inserting already prepared sperm directly into the uterus through the vagina using a thin, flexible catheter. It's a rubber-like tube, actually. The sperm can come from either a partner or a sperm donor. This procedure is usually performed by a doctor in a clinic or a fertility center. The goal is to increase the chances of fertilization by bringing the sperm closer to the egg. IUI is a commonly used method for individuals or couples facing fertility challenges or those who are using donor sperm. However, there are some situations where you can't use this method. For example, if the sperm result shows that the sperm count is lower than normal, is lower than it is supposed to be. The normal is anything from 15 million to over 200 million per mil of semen. So if the sperm count is less than 15 million, it is not advisable to use this method. Also, if the swimming ability of the sperm is poor, IUI is not the appropriate method for you. For the woman, if you have blocked tubes, IUI cannot be done because remember we are inserting the sperm into the uterus very close to the fallopian tubes where the egg should be released into. If both tubes are blocked, then the sperm cannot swim to meet and fertilize the egg. However, if one tube is open, IUI can still be done, but it will reduce the success rate of the procedure. Also, if a woman does not have enough egg in her ovary, that is, if her ovarian reserve is low, this method is not advisable either because with a low ovarian reserve, there's reduced chances of ovulation, that is, reduced chances of the ovaries actually releasing an egg. So the chances of success with IUI will also be reduced. The success rate of IUI depends on various factors such as age, sperm health, and gynecological disorders. Before an IUI can be done, the man must do a semen analysis and the woman must have her fallopian tubes checked to see if they are actually open. Also, her ovarian reserve has to be checked along with other standard infertility tests. The second method I'll be talking about today is in vitro fertilization, popularly called IVF. IVF is a more standard, a more advanced and complex procedure that bypasses almost every step of the natural method of fertilization. It bypasses the vagina, the cervix, the uterus, and even the fallopian tubes. IVF involves your doctor collecting the eggs from the ovaries and bringing them outside of the body, collecting the sperm from the man by asking him to masturbate and submit his sperm, then placing both the egg and the sperm in a dish outside of the uterus so that the sperm can select the eggs and penetrate those eggs in order to fertilize them. These fertilized eggs are then put in the incubator and monitored for about 3 to 5 days. The resulting embryos will now be transferred back into the woman's uterus. When we transfer the embryo into the uterus, the embryo will now look for where to implant on the wall of the uterus, and that's where it will grow for the next 9 months. IVF is usually recommended for individuals or couples with certain fertility issues such as blocked fallopian tubes, low sperm count, advanced maternal age, couples that don't live together, and a bunch of other fertility issues that the couples may face. It provides a higher chance of pregnancy compared to other methods, but it requires the expertise of a fertility doctor. The success rate of IVF varies depending on the age of the couple and the underlying conditions that may be causing the infertility, but it is not 100% successful. It offers a better chance of success than IUI, but it still doesn't guarantee you 100%. Donor sperm or donor egg is another option for individuals or couples who need assistance in conceiving. Donor sperm can be used with IUI or IVF, where the prepared sperm is inserted directly into the uterus or combined with the eggs in the laboratory. Donor eggs can only be used in IVF, where the eggs are retrieved from a donor, that is a younger woman, and fertilized with sperm before being transferred into the uterus. Using donor eggs or donor sperm allows individuals and couples to achieve pregnancy without sexual intercourse, but it involves careful consideration, legal and ethical aspects. Lastly, surrogacy is an option for individuals or couples who are unable to carry a pregnancy themselves. In surrogacy, a woman that is the surrogate will carry this child and give birth to the baby on behalf of another person or couple. This can involve using the intended parent's embryos or donor's embryos, or a combination of both. Surrogacy is complex. It's a complex process that involves so many legal agreements, medical procedures, but it allows individuals and couples to have a biological child without sexual intercourse. So you see, although sexual intercourse is the most common and natural way to conceive, there are alternative methods available for those who cannot, or for those who choose not to engage in it. It's important to remember that these methods will require expertise and careful consideration, so consult a fertility specialist so you can understand which method is best suited for you. If you found this video informative and you want more content like this, subscribe to my channel, like this video, share with your friends, and see you in my next video.